Here are the main alternatives to robotic-assisted surgery for mesothelioma treatment. Mesothelioma is a type of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs, the spaces between them, and the body cavities. The mesothelium produces a fluid that lubricates and protects the underlying structures. Most cases of mesothelioma are caused by previous exposure to asbestos. There are three main types of mesothelioma: pleural mesothelioma, cancer of the pleura, the lining of the lungs; peritoneal mesothelioma, cancer of the peritoneum, the lining of the abdomen; and pericardial mesothelioma, cancer of the pericardium, the lining around the heart. While surgical resection offers the only potential cure for some patients with early-stage disease that has not spread too far, it can be difficult to remove all of the tumor cells due to their ability to invade surrounding tissue planes. This has made minimally invasive surgical techniques like robotic-assisted surgery appealing, as they allow for more precise dissection and visualization compared to traditional open surgeries. However, for many patients robotic options may not be appropriate or available, and there are a few main alternatives to consider. Chemotherapy: for patients who are not candidates for surgery or whose cancer has spread too far, chemotherapy is the main nonsurgical treatment option. Platinum-based doublet chemotherapy is considered the standard first-line treatment for unresectable malignant pleural mesothelioma. Common platinum-based regimens combine a drug like cisplatin or carboplatin with another chemotherapy drug such as pemetrexed or altitrexed. Chemotherapy aims to slow tumor growth and reduce symptoms from advanced cancer, though it does not cure disease. Recent clinical trials are exploring whether adding newer targeted therapies or immunotherapies to standard chemotherapy regimens could provide greater benefits. Radiation therapy: for some patients with earlier-stage localized mesothelioma near the chest or abdomen, radiation therapy may be recommended after or instead of surgery to destroy any remaining cancer cells. External beam radiation uses high-energy X-rays or other types of radiation to target the cancer. Intensity-modulated radiation therapy (IMRT) allows for more precise targeting of irregularly shaped tumors near sensitive organs. Radiation is usually administered in short, daily sessions over several weeks. It can work either alone or in combination with chemotherapy for mesothelioma. Proton beam therapy is also being studied. Active surveillance: this approach entails regular monitoring through scans and exams, with certain trigger points determined ahead of time to guide when active treatment should begin if the cancer progresses or causes symptoms. It may be reasonable for some elderly patients or those with major health issues or very early-stage disease where risks of surgery or chemotherapy outweigh benefits. However, since mesothelioma often progresses rapidly, many oncologists prefer immediate biomarker-driven treatment over initial surveillance alone whenever possible. Pleurodesis: this non-surgical procedure aims to prevent buildup of fluid around the lungs, or pleural effusion, which occurs in many patients with pleural mesothelioma. In pleurodesis, a sclerosing agent like bleomycin or doxycycline is instilled through a chest tube to intentionally cause a chemical pleurisy that leads to inflammation and subsequent pleural thickening, scarring. This glues the pleural surfaces together, blocking further fluid accumulation. Successful pleurodesis provides relief of breathing symptoms from large effusions. Palliative care: given the often advanced stage at presentation and poor prognosis of mesothelioma, palliative care plays an important role. The goal is to prevent or relieve suffering through medical, psychosocial, and spiritual support regardless of the cancer's responsiveness to treatment. Palliative treatments can enhance quality of life by effectively treating pain, shortness of breath, nutritional deficiencies, psychological distress, and other physical or emotional issues related to the disease or its therapy. Palliative care is routinely combined with curative intent therapies or provided if treatment is being declined or has failed. While robotic-assisted surgery aims to maximize tumor removal through less invasive techniques for select early-stage mesothelioma patients, alternatives like systemic therapies, radiation, palliative procedures, surveillance protocols, and palliative care all play valuable supportive roles depending on the individual clinical circumstances, preferences, and goals of care. A multidisciplinary discussion optimizes recommendation of the most appropriate combination of local and systemic treatments whenever